2022.
Okay, good afternoon, and welcome to the February 8th, 2022 meeting of the Delaware County Jail Oversight Board. I'm Joanne Phillips, I'm the vice chair. We have members on the board that are here via Zoom and by telephone. So we'll commence the meeting with the Pledge of Allegiance. Pledge allegiance to the flag,
To the flag,
and to the republic, which stands one nation, under God, indivisible, with liberty and justice for all.
with liberty and justice for all.
Mr. Madden is on the meeting, but I'm going to chair the meeting just for ease of, I guess, the presentation and in hearing people that are in person. I want to make an announcement that the board did hold an executive meeting yesterday on the 7th of February to discuss certain personnel matters and other permitted matters that may be discussed at an executive session. So with that, we typically start with, on our agenda is public comment on the agenda items. That would be if anyone wants to make a comment on anything that we're going to discuss on our agenda. People are welcome to make a comment. And as this board and other boards of the county practice, if you have comments on other matters unrelated to the agenda, you'll be welcome to speak at the end of the meeting at that time. So is there anyone here for a public comment on the agenda? We have some people here, although I think they're all affiliated with our work. And I don't have access to our, I don't know if we're taking, I don't know if there's any email comments at this point, but.
Yeah, Joanne, we are, and I don't see any having come in yet.
Okay,
But
thank
just
you.
as a reminder to the public, they can submit their comments via the Jail Oversight Board web email address, which is JOB as in Jail Oversight Board at co.delaware.pa.us. And just please provide your name and address as normal.
Thank you. So with that, we'll move to item number 3, which is the approval of the minutes from January 2022. Do I have a motion?
I'll move it.
I'll make it a motion.
Second.
Okay, I'm not sure for the record who made the first motion.
I will let Mr. Carson do
Okay,
that.
thank you.
And I'll second it.
Okay, any discussion? Then all in favor, say aye.
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 Aye. Aye.
I think that was everybody. We'll move to item number 4, which is the approval of the report from January 2022. Do I have a motion?
I'll
I
move
make a
that.
motion that we approve the reports from January 2022.
Second.
Thank you. Is there any discussion? Any comments? Hearing none, we'll take a vote. All in favor of the approval of the reports, please say aye.
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 I think that was everyone. Okay, number 5 on the agenda is the approval of the staffing penalties from January 2022. And it's welcome to our new warden, Warden Williams, and if you could give us a report on that.
Absolutely. Thank you very much, members of the board. The staffing penalties for the month of January total $264,498.43, which is a reduction from last month. Current staffing is 72% of positions are filled, which is a reduction from 2% from last month. And the current adjusted staffing rate is 66%. That adjustment accounts for staff who are on a leave of absence. This is additionally a reduction of 2% from last month. To combat this, it's important that everybody knows, and since this is a public meeting, that we are recruiting actively, and we are seeking new individuals to join the Delaware County team at George W. Hill. We anticipate beginning the interview process for internal candidates very soon, but we are presently seeking additional external candidates to join our team. And if anybody is listening or they know somebody who is interested, we do have these job postings available by going to delcopa.gov. You can /employment/by location and very easily scroll down to get to George W. Hill Correctional Facility. If you navigate to that website, you'll see current postings that include case manager, correctional officer, IT specialist, maintenance supervisor, and maintenance worker. We will be establishing additional vacancies as we work through this transition, but we welcome people to apply, and we will enthusiastically receive them for interviews.
Members of the board, is there any discussion or questions regarding the report on the staffing penalties?
Yes, there had been some discussion about making a consideration for the fact that there was one employee of GEO who has been hired by the county, and to reduce the staffing penalty for the amount that would be attributed to this individual. Does someone have on them the exact number that was? If not, we can pull it
I think
up.
it was $3,900 and
$3,576.
So I would make a motion to reduce the staffing penalty by that amount.
I would second that.
Second.
So I think we have a motion to approve the staffing penalties with a reduction based on the amount of the one salary that for the person that's come on board. So with that being said, can we have a vote then? All in favor of that?
Aye.
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 Is anyone opposed? No, that carries, so thank you. So we'll accept that. The next is an update on the coronavirus situation. And if you could do that.
Absolutely.
Thank you.
For the month of January, 266 incarcerated persons were tested utilizing PCR tests. 49 were diagnosed as positive for COVID-19. This accounts for an 18% positivity rate. During County Council last week, Dr. O'Mahony reported similar findings in the community regarding increased rates of positivity, so we are seeing that within the walls of the institution as well. To note, last month, we had a 13% positivity rate. We are continuing mitigation efforts within the facility. Presently, we have 2 individuals who are currently positive in our custody, and we anticipate that they will no longer be under their isolation procedures as of the 14th. So beginning next week, we hope that our number will be at 0. 147 new commits reported that they were vaccinated upon commitment to our institution. Currently, 46% of the population is vaccinated, which is the same percentage as last month. On Tuesday, January 25th, Delaware County COVID-19 Task Force provided an on-site vaccination and completed vaccinations for 60 incarcerated persons. And this, of course, could not have been done without the assistance and leadership from Dr. O'Mahony, who established the clinic on site. In January, 32 staff members were tested, and 29 were positive. We currently have 0 staff members presently on leave related to COVID.
That's terrific. Are we still limiting the in-person visits?
Yes. We are currently discussing how our mitigation efforts, as well as the current rates of community positivity, will influence the way that we decide to resume those in-person social visits. We are still conducting in-person attorney or legal visits. Right now, with 18% positivity, it doesn't feel like the appropriate or supportive step to open, but we are ensuring that recreation is occurring for the population so that they are able to have access to telephones and be able to connect with their family. We'll continue to monitor this situation, and as soon as it's deemed safe, we will be resuming those visitations.
Any board members have any comments or questions? I'd just like to say for my part, I think the board has been solidly behind taking whatever steps that we can to prevent the spread of COVID, and these measures just seem to be a basic requirement at this point in time, and I'm sure we'll defer to you and your staff as we go forward to see what the right time is to change that policy, so.
We agree, and we appreciate the support. Dr. O'Mahony said it best. I think that this wave scared a lot of people. It spread much faster than many of us, I think, were anticipating, and that happens even faster within congregate settings. We have ample supply of personal protective equipment, also designated as PPE on site, and we will continue to take every and all steps to manage this.
And I'm sorry, I'm dominating the conversation since people are on Zoom, but please chime in if you have a question. I was wondering if there's any other plans for any further clinics.
We have not yet established a date, but we are very motivated to continue those efforts. So vaccination is one way that we combat the virus, and we plan to continue those in the future. I've been connected with the new director of the Department of Health within Delaware County, and we will finalize those details. As soon as that's known, we'll communicate that out.
I think that's great. Thank you. Any other comments from anyone? Okay, with that, we'll move forward to number 7 on the agenda, which is the contraband update.
So this is something that just happened within the last hour at our facility. And it's one of the ways that highlights that sometimes when you find contraband, it's not always a bad thing. Because instead of near misses, we have good catches. And we make sure that we as a correctional institution are upholding the health and safety of those that are in our custody. So there was a new commit in our intake department who was perceived to be unresponsive, likely related to substances. The correctional staff immediately, upon monitoring this situation, alerted additional staff. Response was comprehensive, life-saving measures were taken, and Narcan was administered. That individual is alive right now, not only because of the response, but the training and the action that took place. So within the institution, we take contraband very seriously. And in January, we increased the volume of shakedowns or searches within the facility to identify and locate and safely remove items of contraband, which include illicit substances and instruments that could be utilized as weapons from our facility. When appropriate, incarcerated persons who are alleged to have engaged in criminal acts while in the institution are referred to CID for prosecution. So we'll continue to see those trends. They will rise and fall. That is not always a bad thing. If you're finding contraband, you're removing it from the facility and making it a safer institution.
Any comments from members of the board or questions?
I have one.
Please.
If there was a scale to measure, and I mean this lightly because I'm not sure how we do it, when we compare the contraband to our employees and to our residents there, is there, I guess I could say, is there a scale being measured to that? Not in a comparison way, but to find out where our employees are at as well as the residents.
Mr. King, I apologize, but I don't know if I understand the question you're asking.
So, employees that are being caught or found with contraband versus the residents that's being caught or found with contraband, what would you say is, and you're just getting here, right? So
Yes.
This is the question that we've been talking about for years, right? Which one would you say is, I guess the word I want to say is getting better or getting worse? I guess I can use those words.
You'll learn this about me. I like to be confident and accurate in my responses. So today is day 2 of week 2. I don't know if I can speak to that while providing a congruent response with what you're seeking. What I can say is that introduction of contraband in a correctional facility poses a threat to every single person within the walls, and we will prosecute any person, whether incarcerated or employed, to the fullest extent of the law to make sure that we can make this a safe institution.
Thank you. I respect that answer.
Thank you.
Warden, Brian Corson here. Just a couple questions with the increased shakedowns of last month. Was there also random car searches within the prison for the month of January?
So I'll preface it with the same response I just gave Mr. King. I'm not certain. I did not bring that information, but I will say that we will, again, continue any of the procedures that were in place ahead of time to ensure that we are making this a safer institution and that we're deterring anybody from engaging in these behaviors.
Awesome. And what is the status with the mail procedure? Where are we at with that?
So later on during today's meeting, my assistant warden Shaw will be providing a GTL update in which we will be discussing the progress made towards mail.
All right, great. Thank you.
Thank you.
I do just have to say as a comment just for the public and for this board that the COVID experience gave us sort of a control time where, you know, we could say clearly it's not visitors coming into the facility that are bringing things or you know, bringing contraband. So it's been an eye opener, and, you know, that we could see what's going on and try to combat that. So I know that that's something that'll be important to you to keep our facility safe. So thank you for that report. Okay, any other questions from anyone? Okay, with that, we'll move to the deprivatization update, and we have Mr. Althaya for that.
Good evening, members of the board. I'm going to share my screen with you. Can you see my screen?
Yes.
You can
Yes.
see. Okay, very good. Here we go. So, general overview, as you know, the council voted on October 6th to terminate the agreement, and the county has been working to contract for key services. And Warden Laura Williams has started work on the 31st of January, and she has been off and running, as working closely with us to make this transition happen successfully. We couldn't do it without her leadership and without her team's partnership. And recruitment of key staff is in progress, and the overall operating costs within budget. In terms of critical tasks, the warden, deputy warden for administration, compliance officer, office manager, personnel manager have been hired. Personnel manager starts next week. People are being interviewed for deputy warden, for facilities manager, procurement manager, and IT manager. Juno Search, the HR firm that is working for the county, has been spending a lot of effort on recruiting corrections officers and other program staff. They've had over 800 individual expressions of interest in the correctional officer jobs, much fewer that actually follow up and complete an application. Of those, 39 have been screened and 9 are being recommended for interviews to be hired. So there's a big effort going on with a long ways to go still. And this is probably the area of highest attention and highest risk for us is identifying and hiring adequate correctional officers. Medical services is being provided by WellPath. The contract was signed last week. with a transition date of March 6th. GEO has been notified of that occurrence. Food services and commissary with Aramark, the contracts are being finalized. We're hoping to wrap up the food service contract this week, with the commissary contract soon to follow. Other contracts for various aspects of software and other security systems are also being addressed. The Warden Williams team has decided to perform the maintenance contract or work in-house and not contracted out. So U.S. Facilities, who had been recommended for award, was notified that it would not be hired to do this work. We do have an estimate of significant savings on the maintenance efforts. However, contracts for certain tasks, such as the annual fire inspection, sprinkler inspections, the generator inspections, HVAC maintenance, will need to be assumed from GEO or recontracted with vendors, and we will be keeping you up to date on that. Working with GEO, we have a weekly meeting with GEO leadership, corporate GEO, and the superintendent at George W. Hill, and I have to give them credit for working cooperatively with us and generally meeting all of our requests for information and in terms of pricing some of the equipment that we're purchasing from GEO. The GEO leadership has been very cooperative. I want to give them credit for that. The council has approved the purchase of IT equipment pending delivery, and a number of vehicles will be purchased through the state CoStars contract, and a variety of other activities are in progress to do things such as repairing HVAC, transferring records, setting up the financial accounts. The controller's office has a lot of work to do here to prepare the county for takeover of all the financials and all of the HR data that needs to be put into the county's payroll system. Overall budget status, the full contract for GEO would have been $55 million for this coming year. Or for the prison would have been $55 million, with 54.4 for the GEO contract. The current estimate is $50 million, which includes $13 million to be paid to GEO, and it includes $4.8 million in contingency. Currently, the transition costs are estimated at $1.5 million to complete the purchase of computers, software, and other equipment, and that is substantially down from the original study that was done last March. The study was last March that was done, looked at purchasing all new equipment for the building as if it was a new prison, and estimated that at $8 million on the high side. The current estimate is that it will come in at roughly $1.5 million once all the equipment purchases are done. The consultant costs are on budget at $1,027,000. Year-to-date budget status, with the budget being at 50, we're looking at roughly $35 million remaining of that budget, and we're continuing to work to refine and sharpen the numbers on the budget. In summary, we are reporting that the transition is meeting schedule requirements. I have to mention that the county staff, including the team under Warden Williams' team, as well as the controller's office, as well as the county HR office, everybody is working together, and not just Monday through Friday, but 7 days a week, to do what is necessary to support this transition. And it wouldn't be successful without the county staff putting in 150% on this. So we want to give them credit for that. We, the consultants, are working with them, but we couldn't do it without the county assuming responsibility for all of the work that's happening within each department. The biggest challenge at this time is staffing. We have to really ramp up the hiring of correctional officers. I think the new salary schedules that are being offered are attracting interest, but we have to turn that interest into actually hires, and that's the number one priority that we have for the team at this point. The county has made sufficient funds available to do a like-for-like transition with all of the support services, and overtime enhancements will be put in place for those services as needed. The county has also moved forward with design of a central processing facility, which will definitely have a positive impact on controlling the population and over time reducing the population at the prison. And reducing the population is important to actually reduce the need for increasing staffing to the level that it currently is scheduled to be. So with that, I will exit the slideshow and entertain any questions from the Jail Oversight Board.
Does anyone have any questions or comments to make regarding this? Howard? No, you look
I'll
like
just
you're-
make a couple comments. One on the decision to do maintenance in-house. I think one critical part of that was not the desire, but the importance of making sure that we had 24/7 coverage from a maintenance perspective. So I think it's important to note that that was a key part of that decision. And I also just want to echo the comments from Mr. Al-Sayeh about the extraordinary efforts of our county employees to get us to where we are. We still have a lot of work to do. It's not time to celebrate per se, but getting us to where we are, it really has been a all hands on deck effort 24/7. So thank you to our county staff who've gotten us here thus far.
Madam Vice Chair, if I may, as part of the discussion on deprivatization, yesterday during the closed session, we had some personnel matters that came up that include the recommendation to make some incentive and recognition awards to 3 key staff members. And since this is the appropriate part of the agenda to bring that up, I'd like to make a motion to recognize 3 particular individuals without whom we wouldn't be where we are. And those are the interim warden, Ms. Donna Mellon, to make a recommendation of a recognition award in the amount of $10,000, Ms. Kelly Shaw in the amount of $5,000, and Ms. Nicole Miller in the amount of $5,000.
I would second that.
All in favor?
I'm sorry.
Aye. I
Aye.
just like to, and I should have spoke before this, but I just wanted to say thank you to the county staff that have been manning the reign since the time of the Jail Oversight Board came into effect. And people in the county may not know, but we really have been running from the county side with really a very 4 people for a good amount of time, and they really keep a rein on our business and the time and our bills. And we very much appreciate their work. I say that from the controller's office too. We deal with the people at the jail, and then they've done a really good job. So we thank you for your public service.
And I want to just call out our controller for really championing this consideration.
That was an easy one. Thank you. So, all right, great. Any other questions on the deprivatization? I'll just echo that there still is a lot of work to be done, and we're all on it. So, and if any board members have any questions during the week or anything, if they want to check in with any of us that are, in the operation side, please feel free to reach out to any of us. Okay. With that, we'll move to number 10, which is the warden's report.
Thank you. Our current population is 1,387 individuals. Accounting for that is 1,239 males, 148 females, and we've had 40 lodgers. We had 32 weekenders reported from Friday to Saturday or Sunday. Total commitments in the month of January were 431, with discharges totaling at 457. Our recidivism rate is presently 59%. We had no major incidences to report within the last month. In terms of behavior health, on Thursday, 3 residents are scheduled for transfer to Norristown State Hospital, pending their COVID results, and that would bring our wait list down to 5. We currently have 14 incarcerated persons who are awaiting commitment on the 402. In the month of January, we also discharged or diverted 59 incarcerated persons to appropriate inpatient drug and alcohol treatment programs. In terms of maintenance, this was updated as one of the things that is ongoing. And we have Unit 2A and D remaining closed. That was reported previously. We are still awaiting repairs to the heating system. We are continuing to utilize temporary heating for Unit 2A and D for programs. So within this, I want to speak from, my previous experience, which I feel very fortunate to have, and coming into this institution, knowing the barriers that COVID has placed, as well as staffing transitions. And I really, truly couldn't believe all of the work that is being done. And I'm certain that we don't celebrate the positive nearly enough. So I hope to be able to capture that within this section. Contact teaching is still continuing in small unit cohorts. In January, there were 54 students enrolled in GED preparation class, and 28 GED tests were administered with 36% passing. It's important to note that many people are not aware that you have to pass 4 different sections within the GED in order to accomplish that. Though the whole number may seem low, this comes at an enormous investment from the participants in the program as well as the educators who are facilitating it. We had 2 individuals who earned their GEDs in this past month. And again, I want to congratulate those, particularly Joanne and her team, for making sure that during this time we're still achieving education or access to it while individuals are with us, hopefully for the short term. In terms of medications for opioid use disorder, we do have some updates. I'll discuss first buprenorphine because we have the most recent updates to that program. Thursday on January 27th, WellPath met with county staff to ensure that we could complete an introduction and review the COSAP Suboxone grant proposal and initiate those next step discussions. We held a follow-up meeting today, and the participants included partners with WellPath, Department of Human Services, members of our single county authority for drug and alcohol programs, Crozier, current GEO Group healthcare members, and George W. Hill administrative staff. I'm so excited about the future of this program. During today's meeting, we discussed standard operating procedures and confirmed resources that will be committed to ensure that we can begin to provide buprenorphine services at the time of WellPath's transition. Our first step towards a sustainable program will be to continue all active buprenorphine participants, and those are individuals who test positive at time of intake and have a verified active prescription while they are admitted to our institution. As this process gains traction and we stabilize in the transitional needs of WellPath, we will expand towards induction for those that are assessed as clinically eligible for this program. This is very exciting. And we as an institution could not execute a program or expansion like this without all of the investment from our partners. Within our Vivitrol program, we currently have 10 clients, 5 males and 5 females. There were 4 graduates in January. And though we recognize that enrollment has decreased from previous months, that is largely related to some of the challenges and struggles, again, with the spike increase in our COVID numbers, as well as staffing transitions. I would like to acknowledge Tiffany, who's our prep coordinator. She stepped in to assume additional duties and responsibilities to ensure that these necessary functions continue. She's increased her engagement and instruction for this population of participants and has been motivated to find strategies and resources to provide this necessary resource. Assistant Warden Shaw will provide updates regarding the progress of some of our other programs, as well as the progress with our partners at ViaPath, which is formerly Global Tel-Link or GTL. So that was discussed earlier. Before she begins, I wanted to just kind of reassert some of my immediate observations regarding the program departments in the facility. I transitioned from an agency that supported the development and expansion of programs, and I feel so fortunate to have joined this team of hardworking and dedicated professionals. And with that, I would like to pass over the remainder of the portion to Assistant Warden Shaw.
Thank you.
Thank you, Warden Williams. Good afternoon, members of the board and the public. For the month of January, Workplace Essentials had 10 participants with 2 completions. Workplace Essentials is a course geared to life skills that focuses on interview skills, achieving good credit, job search, and resume preparation. 8 students earned a Flagger certification. Flagger certification is taught in accordance with PennDOT guidelines. Upon release, formerly incarcerated individuals would qualify for a Pennsylvania flagging position. Thresholds restarted micro sessions with clients on Monday, January 10th. Thank you to our chaplain Dunn for coordinating volunteer training and deploying a schedule. There were 60 participants in Prep 1, which is our drug and alcohol program, with 13 completions and 30 new enrollments in January. Prep 2 had 25 participants with 6 new enrollments. Prep classes continue to go hybrid with both mobile and in-person instruction. ViaPath services update. As Warden Williams mentioned, GTL is now recognized as ViaPath Technologies. ViaPath Technologies redirects itself to transparency and helping formerly incarcerated individuals acquire successful training and employment. ViaPath currently provides the facilities phone, tablet, and video visit services. And in reference to Mr. Corson's question, upon signature of the ViaPath contract, they will be providing a third-party mail management system. We had 542 video visits scheduled in January. Video visits continue to be free to the public and are available between 9 a.m. and 2 p.m. Monday through Friday. We continue to coordinate with ViaPath to execute video visitation on the housing units. Thank you.
Thank you. I just wish we were here in person so I could see Mr. Corson's face. Because Mr. Corson and Mr. Madden, and the whole board has worked, but the 2 of them have worked, really been champions of moving forward with some of this programming. And I think it's going to be really hopeful that we will actually be frontline in charge of it soon. I know it's a big challenge and it won't be easy, but it really is a culmination of things that I've heard on this board for 2 years of what people have wanted to see happen. So I say thanks to all of you and to the members of the board that have really pushed this idea forward, especially for the medical treatment for the opioid disorder. So I don't know if anyone else has a comment, question?
No, I want to thank you, Joanne, and thank you, Warden, for bringing that update to us. In the decision of voting about deprivatization and what a huge issue that was here in Delaware County. I mean, such a big factor for me was that program and that grant that we've been sitting on for over a year, and to get that news that 2 months less than 2 months out of Delaware County taking over the jail, that we're getting that positive news about this programming, and to see the leadership as enthusiastic and gung-ho about it as we have been just really sets a different vibe and a different pace. and it's really the vibe and the pace that, you know, we've really been pushing through for the last 2+ years. So I'm very, very grateful tonight to be able to get that news and thank everybody for their continued support, and to just hear a room full of amazing stakeholders that are part of this program that are all working towards the same goal. And I think that was our goal in this transition, working towards the same goal. And it's really nice to be on a team where we're all headed towards that same direction. So I want to thank the warden for sharing that tonight. And I am, you know, very, very excited, and I thank you.
Yeah, with that, thank you. I also realized that I didn't really, we sort of ran through the transition committee, and we've talked a little bit about that, but I didn't give Mr. King any chance to talk about the reentry subcommittee, and if he wanted to make, you know, any reports or comments. I hear in the warden's report the discussions of the programs that are going to put these, you know, people will be formally incarcerated into jobs, and I know that that's something that's really important to the reentry subcommittee, which with Ms. Love and Mr. King. So I don't know whether Mr. King wants to make any comment.
Yes, I spoke to the warden. I want to say thank you to her. We have been communicating. We are trying to set a date that is feasible for all of the people that's on the reentry subcommittee. I wanted everyone to be involved. I'm gonna tell you that one of the greatest things I heard, along with a lot of these great things that the community and the public needs to hear about what we're doing as a community and as a county, that 59% recidivism rate, like, I really honed in and paid attention to that. Now, to my understanding, and I could be wrong, maybe someone can correct me, I think that's the lowest I heard yet.
I think it is too. I was thinking we've never been below 67% in my recollection anyway.
67% and 66% is like the average of the country, kind of, sort of. So to have it at 59% at this point, that's a big deal. And I just have to say kudos to the institution that's working very hard. And I know some things happened before Warden Williams got there, but she's definitely on the ground running, and she's in a great situation with a great team of people who are supporting her, and will continue to support her as long as I'm here on this board. I know I will. So I'm happy to hear about the programming. I can't wait till we have our meeting so we can work on things to move forward to make people, to help people in the county prison to be successful when they leave.
Okay, thank you. All right, so that completed the warden's report and some comments on that. We come to item 11 on the agenda, which is public comment. I don't know if there's people here that want to make any public comment. If you are, you're welcome to come to the podium. Just ask that you give us your name and address, and please speak with your mask on, even though it's tough. So thank you.
Getting used to it. Hi, I'm Mary Austin, 1036 First Avenue, Media, PA. I just had a question about, and also from Delco CPR, really glad to hear some of the things that are starting to happen as we get closer to April. I just, and maybe I missed it, had a question about the pricing of the phone calls with, I guess it's ViaPath that's going to be taking over, if that's going to improve, and also the intake fees. I know at one time were completely removed and have come back, and so I didn't know what the plan was to make those changes, if that's going to happen before or after Delaware County takes over.
I have to say that I know we don't have to answer the questions. I think on the intake fees, we're going to have to come back to you on that unless someone, I think we need to follow up on that. I think you're right. We haven't really discussed that for quite some time. So I think we should follow up on that. And with respect to the phone, we're really keeping the same the same company that was providing it, and we had already reduced that phone charge rate maybe back in August. I think it was reduced. So I think that we're just continuing with that same contract. And then my understanding is that the tablets, the video visits have been free during this time. So, but we can keep monitoring that, but I don't think there's a change to the phone. But on the intake fee, I think we should follow back up with the warden and her team on that.
Yeah, on the phone rates, that was reduced pretty substantially. I think it was over a year ago now, to be more in line with our neighboring counties. So it will carry over with the change in name.
I think that's all the public comment we have in person. I don't know if there's anything that came in on email. I don't have access to that.
I don't see anything.
Okay.
Joanne.
Okay. Thank you for your questions. So with that, number 12 is board member comments. If anybody has a comment they'd like to make, please jump in.
Joanne, it's Deb Love. I would like to just ask a question / direction from the board. Early on when we reorganized to be this board, Chairman Madden had asked for a staffing subcommittee similar to reentry and the drug and alcohol. After a couple of meetings with Mr. King and I were the two on the group, there wasn't much that we could do with the existing contract. And so with the changes, I'm curious if Mr. King and I, if he chooses to join me or anybody else would, is there a reason to re-energize the staffing subcommittee to look at things with the new organization, or are things pretty much staying the same with the transition? I was just trying to go back over my notes of some of the promises that we had wanted to take a look at, but again, with the limitations of the contract, we weren't able to do so.
For my part, I'd say there's a lot going on the staffing front. I mean, everything that we put in place in terms of setting this board, setting the new rates that are substantially higher than what they were under GEO, the efforts that are being made to attract people who are interested in working for the county. A big part of what we heard from Mr. Alsea is what we're doing around staffing and ensuring that we improve the staffing levels. Now, of course, any member of the board who's interested in leaning into a particular issue and playing a more active role, I'd certainly welcome that. So if you and or Mr. King want to, get further involved in what's going on from the hiring front, that's always welcome.
Thank you. And who would you suggest to be my point person to make that reach?
I would say Mr. Alsea.
Okay.
Yeah, and just to follow up on that, I think that there's so much work going on now for the hiring and staffing that it may be Ms. Love's right that we would really re-energize that committee. I think in the past we were concerned about the lack of staffing and the penalties that we were seeing. But I think there'll still be a need for that once we get on the ground running this ourselves. I hear that comment, and I think on the reentry side as well, we've sort of had to be in a holding pattern because of the transition and all the work happening. So, and there wasn't much we could do. So I think that is going to really be re-energized. So.
And I guess I would revise my response. I think, with Ms. Williams being on the ground now, I would really follow up with her in terms of who she'd like, from a staffing perspective. If there's something you can play further, it's really Ms. Williams now.
Sure. And then I guess my question is just the timing of re-energizing, not so much from where I stand, but from all the changes and the nuances going on, new leadership, et cetera. Should I wait to begin these conversations after April? Wait till May? I just don't want to add time to people's already busy day with all that's going on.
Frankly, I think that if we waited until May until we took over, I think that would be fine because I think there's so much work going on now for staffing that it would be really hard to even gauge where we are till we get across the finish line. And then I think there might be a need for board, involvement. That's just my thinking. So that's from my end. I mean, others may have different views.
Joanne, I think one of the benefits that we haven't talked much about with the operation coming back under the county is it removes all the obstacles to accessing the full suite of services that the county offers through human services, through new health department, through other areas of county operations. And I think to Ms. Love's point, as we get to having full control, the ability to leverage all those resources is pretty remarkable, and it will come to play in how we look at the future of staffing, both on the grounds of George W. Hill, but also in the support. So I'd welcome those conversations. I do agree that we need to engage in hiring so that we can get possession. And then once we get the training wheels off and we've got our balance, I think it's a great conversation and it's an important subcommittee to re-energize.
Okay, so I think I'm hearing waiting until the transition happens, some of the hiring has occurred. So unless there's disagreement to that, I'll just kind of put that on hold till the month of May and then reach out to our new warden.
Yeah.
Okay, and please, if something changes or whatever, just let me know. But I know it's been kind of sitting there, for 2 years, kind of not doing anything. So thank you.
Thank you. Any other comments?
I would just like to welcome our new warden and thank her for joining us. And just to echo some of what Mr. Corson said, one of the major elements of Ms. Williams' background that attracted her to board members was her background in treating those with opioid use disorder, among other substances. And so her enthusiasm and energy for getting this medication-assisted treatment program up and running is extraordinary. It's rare that we have something that can so directly, literally save people's lives, but this program I know will.
Thank you. All right. If there's no further comments or questions, I guess I'd accept a motion to adjourn.
Make a motion to adjourn.
Second.
All in favor?
Aye.
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 Okay, thank you. We're adjourned.